We're going to go ahead and get started, and hopefully some others will trickle in. I know there was a room change, so it might take folks a little while. So welcome, everybody. My name's Tina Tran. I'm the State Director for AARP here in Texas, and it's such an honor to join you in this beautiful new building. I have the pleasure of introducing our distinguished panelists. This is the older adults panel, so if you don't want to be here, you're stuck. Sorry. And you're going to get a lot of really great information today. So I'll start by introducing Mike Nguyen. Mike is the executive director of Bamboo Villages. The Golden Bamboo Villages is a group of housing developments that serves seniors here in Houston. The vast majority of the residents are Vietnamese American. And Angela Chen is the director of the daycare center here at the Chinese Community Center. And Sandy Rogers is from the Unlock organization, which is the premier PACE, P-A-C-E, program here in the United States. There's much longer bios in your on the website. So if you'd like to learn more about our panelists, please refer to the conference website. So I'm going to start with a bunch of questions for our panelists here, and we're going to save about 20 minutes at the end of the program for your questions. So go ahead and get started. In each of your areas of work, what trends are you seeing in terms of mental health and overall health? And Angela, I will start with you.
Yeah, sure. In the trends of seeing the overall mental health for the in the mental health field, I would say it's the caregiver stress and burden. Yeah, as I know a lot is a lot of caregivers, they are burnt out of their taking good care of their families, their loved ones, but however they were forced to give up their job, and that's cause economy boost, but they really need the more support from the society and figure out what kind of resources that they can get in to help with not only caregivers but only their families members. So I would say the caregivers mental health will be very important issue, and so I would say in the more near future, the society, we will have to develop more support and as well as the information and resources for the caregivers. And as speaking of the elderly themselves for their mental health, I would say a lot of them are feared of death. But in the Asian population, they against to talk about this kind of topic. Yeah, because they saw this is very sensitive, but the more they afraid of speaking of this, and their mental health getting worse. From my own experience, we have many seniors that are very anxious about the death, but if we want to talk to them about what's about the death, and that they refuse and they reject to talk about this because they have a lot of dread inside them. So I would say it's very important for us to create this the culture and change the culture for talking about the death. Yeah.
Thank you so much, Angela. Sandy, how about you? What trends are you seeing in terms of mental health and overall health and the population that you serve?
For those of you, just briefly, that aren't completely familiar with PACE, which is the Unlock founded PACE, which is the program of all-inclusive care for the elderly in Chinatown back in the early 80s, San Francisco Chinatown. We serve over 1,900 individuals in and around the San Francisco Bay Area. There's over 70,000 under the PACE program nationally. But with the trends that we're seeing, that over 1/3 of the individuals served, and this is nationwide, not just at Unlock, have a mental health diagnosis. And with that mental health diagnosis also comes the use of prescription medication. And very often there is the challenge of medication errors. There is the challenge of just coordinating the care. There's the challenge of the stigma of being diagnosed with a mental health diagnosis. And, with that, even just the term, if you look at, there's mental health and then there's dementia. And there's a lot of confusion out in the community as to, are they not one and the same? No, they're very different. Mental health, it could be things like schizophrenia, while dementia, is its own disease with multiple types of diagnosis associated with that. Alzheimer's is just one diagnosis. But what we have found is that there's a cultural divide with the information that's coming out into the community and how it's interpreted by different cultures. Very often, in speaking with the individuals that I interact with on a regular basis, there is that interpretation of, and again, I use the word stigma, of looking at a word like Alzheimer's and means crazy person when it's translated. So, individuals are less likely to seek assistance if they don't have a correct understanding of, what the diagnosis is and such. So, continuing to work out in the community for us is such a critical element of, that education, not only to the families that we serve, but also, the further reaches into the community. So when somebody does encounter a family member or friend with mental health diagnosis, it's the information is delivered in the way that is best understood by them.
Thank you, Sandy. Mike, same question to you. What trends are you seeing amongst the residents that you serve in your housing developments?
Yeah, thanks. Thanks for having me, by the way, Tina, and Hope Clinic as well. And very honored to be on this panel with these great guests here. So speaking of the Golden Bamboo Villages, we have 3 properties. 2 of them are senior, one is multifamily. Very diverse properties, but in this case, since we're focused on AAPI, I want to focus on our Golden Bamboo Village 1, which is right down the street on Bel Air. We're 62 and up. It is primarily Vietnamese people that live there. When we talk about mental health, and you're correct, there is a difference between dementia and mental health. But with dementia, I mean, you can kind of categorize a little bit of what goes on in there with some mental health. And I want to give a shout out to a great friend of mine, Christina Miyawaki, who has done amazing research. She's a professor at U of H who has spearheaded this research for multi-year and talked about dementia in the AAPI population. And so she focused on the Vietnamese community through Golden Bamboo Village, and actually has gone there multiple years and interviewed people, surveyed them, have done activities with them. And so I want to talk about that because I think dementia is something that's not talked about enough in the AAPI community. I'm not sure about the whole AAPI community, but for sure in the Vietnamese community, which I'm Vietnamese. I have my mom who is getting older now, and she's very healthy still, but it's starting to happen a little bit, right? So I'm becoming aware of it as a child, as her child. But on the property, I think it needs to be talked about more within families because we have an independent living property. So that means there's no assistance on there. You're able to live on your own. But since it's 62 and up, our demographic can range all the way up to about a 90-year-old that's trying to live on their own. And when dementia starts taking effect, some of these seniors don't realize that it's going on, but they're still trying to live independently. When Christina did her research, it not only did it cause awareness within the community, but it helped us as far as managing the community, because what happens as managers of the property and residents, we do our best not to step into their privacy, not to step into their lives, not to contact family when we feel the need that we should contact family, right? And why are we contacting the family? Well, if they're not able to function on their own, well, you're now causing not only hazardous to yourself as a resident, but also your neighbors, the property, You know, we have instances where it could be a cleanliness issue, right? A pest problem, bed bug problem, and they're just living in it. They have no idea they're living in it. We have no idea because it's behind closed doors, but then it starts seeping out to neighbors. So other units are getting affected. You know, our Vietnamese people, our Asian people love to cook. And so, you know, they're always cooking. They leave their stove on and they have no idea the stove is on. It's on all night. We've had fires happen as well. Now we're putting people in danger. When we talk to them about their mental health or, you know, memory loss or, you know, their functionality, they don't want to admit to it. I mean, you know, I wouldn't want to admit to it myself if that was happening to me, right? It's a sense of pride. So because they don't admit to it, then they think that they're okay, nothing's wrong. But on the outside, as a third person, we see that there is definitely something wrong, and we need to make them aware, make the family aware as well. But again, we can't step into that privacy. We do dance on that fine line though. So when it comes to that need, we will step in, and we have to call some type of family member and let them know because it is endangering others. But when we talk about trends, I think this is something that needs to be talked about. More awareness needs to happen. More families need to be aware of it. You know, when we contact some of these families, you know, their kids are just out elsewhere and they're like, oh yeah, we haven't talked to mom and dad in a long time, you know. And it's like, hey, you need to, you know, keep that relationship going, because I think it's time to, something needs to happen, right? So hopefully that helps answer that. Yeah, I don't want to take up too much time.
Thanks, Mike. Sandy, to follow up on some of the answers that you gave around, you know, talking about prescription drugs, and are you starting to see that there is there a gap between understanding the mental health and getting the correct prescription drugs? Are you starting to see like an abuse of prescription drugs? What is it, and what are the opportunities to address those issues?
So that's a very important question to be asking, because, you know, there is a tendency out in society to overprescribe. But the overprescription very often occurs through the lack of coordination among healthcare providers. Individuals may see multiple individuals out in the community, multiple healthcare professionals, and there's not always that coordination of care among those individuals. Whether how well medical information is shared in the community, though there is a positive trend occurring where different healthcare providers, health systems are creating a central database of information. So you'll be able to, a provider, you know, a physician would be able to look at and understand if there's other medication that person is looking at. But also it's the, you know, even if the correct medication is prescribed, is the ability of that individual to self-administer. And so whether they understand that medication is, they may be on a dozen different medications. Many of them, you know, properly interact, but if you don't take them at the correct time, then there could be adverse effects. So whether you have to take it morning, middle of the day, evening, and such. So there's many different factors, you know, that go into that, you know, I call it medication management. And for older adults that are experiencing underlying mental health, that is a critical component. And if it's abused, they end up back in the emergency room. It puts pressure on the health, you know, the overall healthcare system, creates more stigma about the use of prescription medication versus sort of natural ingredients that are very often found in different cultures. So those are some of the key areas.
That's really fascinating. I experienced a lot of that with my grandfather, who had dementia in his later life, and just seeing how the interactions with drugs would change over time. And so the constant monitoring of, you know, the drugs that he was prescribed was constant, because if you introduce something else, then it could interact. And yeah, that was, and so that management was critical. So Mike, following up on what you said about sort of the hesitancy sometimes to contact family to protect privacy, if you could, what do you see as some of the opportunities, you know, just in your work alone with these housing that serves a very specific population, to increase the safety and sort of increase this, the resources and services that folks might be available to them?
That's a good question. I think I would suggest, there is so much funding out there for all types of things. If there's organizations, groups out there that are willing to find the funding to provide activities for seniors, friendships, relationships, and again, activities for them, exercise, get their minds moving, get their blood flowing. And I think that's the biggest problem with the older generation, or not older generation, but older adults. There's not enough movement, and when that stagnant movement happens, I think things like dementia can start taking over and taking more of an effect. So we can only do so much at our properties. Yes, it's an apartment complex, but as a nonprofit V and Teamwork, we also provide activities there for them. But there's only so much that can go around. So we do need to utilize our community friends that are out there that are willing to partner with us and offer these services to seniors, and just get them active, get them moving around, get them to do things. And that's going to definitely help prolong any type of dementia. And then that way, we don't have to dance that fine line and make that decision. Do we reach out or not? Because there's plenty of times we've tried to reach out to their family, and it causes a scene. Our residents get really, really mad about it. Why are you contacting our family? But it's becoming an issue. So yeah, that would be what I would suggest to our audience is, those out there in the industry, seek for those funding sources, and we all need to work together for our older adults.
Right. And Angela, you talked about those difficult conversations around death and how they're not happening, and also that caregiver stress. Are there things that you have implemented in your own sort of adult daycare center, or organizations that kind of come in contact with the adult daycare center that you're seeing are making a difference in those key areas around caregiving and actually kind of end of life discussions?
Yeah, sure. So at the senior center I work, so we do have the caregiver support information. So because we at the Chinese Community Center, we have a lot of programs such as social service, and the social service department is the best friend of the senior center, because we connect to them a lot. We ask for their help because they have social workers. So when we met at the very challenging situation, or if the caregiver contact to us and ask for help, so we can connect them with the right department. And because Chinese Community Center has in Chinatown for more than for 45 years, and yeah, this year is our we are going to celebrate our anniversary. So Chinese Community Center, we have a lot of good partners, so we know what kind of resources we can connect to the families that they really need help. And I want to go back to about what Mike mentioned. Yeah, so at the senior center I work as, we have adult daily activity and health service. So we provide activity service. So I would like to say, because the prevention is much more important than treatment, I would say, because we want to keep the seniors their healthy time as long as they can. That is because, for example, we have some dementia seniors, and they at the very first beginning, they came to our center, and they are very their dementia is very severe, but with after half year, we can see their improvement, because in their isolation decrease, and their interaction with us other seniors is very important for them. And yeah, so I think for the senior center I work as, we also provide a wellness program for the young elderly, age like 50 to 70s. We have more than 15 courses for them to attend in the class, so we can keep them actively aging. So I believe that is a very important part for the seniors. Yeah.
May I piggyback off that real quick? Thanks for mentioning that, because another service I think partners out there can get is transportation. Transportation for seniors is very important, because we want to keep them active at our property, but we also need them to leave our property and go to places like Chinese Community Center, so they you know, I don't know if anybody's seen some of the programs over there at Chinese Community Center, but I've been over there during pickleball, and they get very serious over there, and they play really hard, and I love to see older adults playing that hard where I mean, it's intimidating. I don't even know if I want to step on the court. But yeah, transportation to get the seniors off of the property, right? And out and about, go to see things and then interact with other people, and instead of just like themselves in their unit or just the people they're around at the property. But that also is going to very much increase their well-being and their mental health.
Thank you. Sandy, we've talked a little bit about the PACE program, but we know it's a promising model to deliver quality care to seniors. And Houston has for many years wanted a similar program, but doesn't have one yet. So in your view, what needs to happen in order to bring PACE to Houston? I know you're chopping at this bit. Yeah, you're ready.
I'm ready for that one.
Yeah.
So just brief history. There are 3 PACE programs in Texas, Lubbock, El Paso, and Amarillo. Okay. And actually the program in El Paso is one of the original 10 demonstration programs that was created when it was first being evaluated by Medicare to make it a formal program. So that's the good news. And actually there's over 800 older adults that are served in that program. But here's the flip side. There's also, Texas has the highest number of individuals in the country that would be potentially eligible for PACE, but don't have access to PACE. Over 150,000 statewide. We did a study about a decade ago for the Asian American Health Coalition and the Hope Clinic to look at specifically Houston. And there is a defined need. There's upwards of 4,000 individuals within the greater Houston area that would be estimated to be eligible for the PACE program. And so, but what are the challenges? So why not? Okay, so why not? And actually, since 2017, when they changed the federal regulations to allow for-profit organizations to start a PACE program, there's been a nearly 50% increase nationwide on the number of PACE programs around the country, but there's been no growth in Texas. Why? In part, because the program is also funded, PACE is funded through, if you're a dual Medicare and Medicaid, then the state and the federal government combine for that reimbursement back to the PACE program. The state of Texas has one of the lowest Medicaid rates in the country. So one, it is tough to become profitable under the current guidelines. 2, it needs to be supported at the state level. And in 2023, the PACE programs that were operating in the state lobbied to expand PACE. And the House approved it, but the Senate sat on it and would not consider it under the current year. And the next legislative request is in early 2025. So as much as there is demand, there is funding out there, both through for nonprofit as well as for profit. It's got to be driven at the state level, which means you need, candidly, lobbyists to get the ear of those individuals that are sitting, in the House and the Senate to be able to support that kind of growth and authorize that expansion.
Great. So Sandy, if what are the organizations in Texas, in Houston locally, that are currently advocating for PACE and to bring PACE to Houston? And essentially, how can we connect with them?
Well, there are, the biggest trend that I've seen, I mean, of course, there's the AAPI, and that's what originally led me to be contacted because of let's do a feasibility study. And I was like, well, we can, defer back to 10 years ago And so we know that the demand is there, but there's also the organizations mostly driven at the national level by organizations that are for the for-profit. You know, they're the ones that have the funding to be able to hire the lobbyists to create it, because there is a tremendous want. But if the focus of the state government isn't on the expansion of PACE, and candidly, PACE is shown to save the state money because of the reimbursement model of it being a capitated amount. So for each participant that's enrolled, the program receives a fixed sum of money, regardless of their health. So generally in the last 18 months of life is when the greatest amount of money is expended. The state, you know, has, you know, and would be spending more money for those older adults. They would save money under the, you know, under the PACE program. So in part, it's really gaining the ear of the state legislators at this point in time. There's organizations, very candidly, Unlock, that were only in California. We're looking to expand nationally. And so it's putting the weight of organizations such as, you know, Unlock behind that initiative. And also the 3 organizations, especially El Paso, with over 800 participants, which doesn't seem like a lot. And candidly, the large managed care organizations like Blue Cross, that's what they have in 3 city blocks. So PACE against the others is a very small program, but it's when you see what it does and the level of integrated care across socialization, transportation, as was mentioned earlier, medical care across every specialty imagined, nutrition, home care. It's a great model. It's just a matter of driving the visibility at the, you know, at the state level.
Thank you, Sandy. Now turning to you, Angela. As director of the Adult Day Center at the Chinese Community Center, can you highlight some of the services you provide and the resources you're bringing or want to bring to the Adult Day Center?
Yeah, sure. So I serve at the senior center under Chinese Community Center. And so for the adult daycare, we provide transportation, like Mike said. It will be very important service for our seniors. Yeah, so we provide transportation and Chinese meals. And we also have the care plan, and as well as the health education for them. So for the health education, we educate our seniors to about how to self-management their chronic disease, because we realize that educate them to become have the awareness of control their illness would be very critical for them during the process of aging, because when they cannot manage their chronic disease by themselves, and they won't have the very smoothly aging in the aging process. So and we also have the small group therapy on our floor. We have the mental health consultant will come to our floor every week, and they will conduct a small group therapy for them, and we will monitor their mental health. We do the evaluation for them. So we will monitor their mental health progress, about their improvement of if something change about their life, and we will see how about their mental health process becomes worse at that time, and we will make the intervention. We will talk to them, and we will ask them, we will help them with we can do for them, for example, to contact their families, or let them know if there are any resources that can ask for help. And so we also have the nutrition program for our seniors, because we have we deliver Chinese meals for them every day. So we have a dietitian, and they will consult us with the nutrition, and they will monitor their meals to make sure that they get enough nutrition they have to every daily. So, and regarding to the resources we have for our client's mental health. Besides for the small group therapy, we also have a clear care plan for them. For individual, we will interview them at the beginning when they join our program, and we will make an interview with them to know about their life story, their previous background, so we can have we can more understand with their situation and why the reason why they come to our center. For example, we have a patient that he has diagnosis with dementia, and their families and he lived at home alone, but his family is very worried about him. But just like Mike mentioned, he always forgets he went out and he didn't show up a whole day, and so they are very worried about their father, so they send them to our center. And because we also will have the education for our staff about the dementia, Alzheimer's. So we will have the ability to take good care of them. Yeah.
And right now, how many seniors do you see in your day center?
Currently, we have 55 seniors. Yeah, and we are looking for more seniors. So we do outreach to our community partners, and we also will provide the class at other community centers, so we can connect all the resources for these AAPI populations.
And does each one have their individualized care plan?
Yes, they do. Yeah, it's a lot of. So we want to make the care plan to become like a system. Yeah, so everyone will have their own care plan. When something comes out, we will go back and look into the care plan and to figure out what kind of trigger their life change, and we can make the intervention.
Thanks, Angela. So, Mike, we've talked a lot about your sort of the Golden Bamboo Villages, and so can you tell us, kind of advise us on what are some of the considerations in providing housing for this population, and what residents and their families should keep in mind when looking for housing in their later years?
Yeah, thanks, Tina. When we develop it, so in the affordable housing world, you know, we have to worry about, we are regulated by all three levels, federal, state, and local. We have a thing called fair housing. We got to, you know, make sure that this is advertised out to everybody, open to everybody. As long as they are low income, they're allowed to live, right? But when we do develop, you know, we try to, it's one of the layers that we put into our development process, but we try to plop our properties in areas that do have an Asian demographic, specifically in the Vietnamese demographic, because Viet Teamwork, I mean, we're kind of a staple name in the Vietnamese community. So not only are we helping our own community housing for our community, but, you know, on the business side, it helps with our lease up as well. But on our properties, I would say, other than Bamboo One, our other properties, it's about 20 to 30% AAPI Vietnamese people that live there. And so that as far as us developing, we do kind of look at that, but we do keep it open to everybody. It's a very diverse property. We have over 15 different languages on our properties. But as far as, you know, families and seniors that are looking for housing, yeah, I do recommend, you know, maybe reaching out to organizations like us up here that might know about some of the housing projects. For the Vietnamese community, of course, Bamboo Village 1 is kind of the popular one. I think Rainbow Village is another property down the road that is heavily on the Chinese side. But I say all that to say this: it doesn't have to be just an Asian community, because, you know, I experimented with this over at our Bamboo Village 3, which is 55 and up, and that's our very diverse senior property. And let's be frank, in the older generations, right? It's not everyone is the most racially equal or educated, you know, and so it's kind of the most difficult. And I knew that was going to be a daunting task when we opened Bamboo 3, and when we were combining such a diverse demographic in the older generations. You know, how is this all going to mix together when we have our senior services and bingo days and exercise? Is everyone really going to mesh together, right? And so, you know, I said this during our grand opening. I said, you know, one thing to be able to combat that would be to really focus on what seniors want. They want to worry about their relaxation and their peace in what I like to call their last quarter of life, right? The least stress as possible, but still have fun, you know, in your last quarter of life. And so when we did that, you know, we provided exercise programs, the bingo. Seniors love bingo. They will not go a day without their bingo. Don't take the bingo away or they get really mad. But they started becoming one together. They started, you know, at first everybody had their own tables. You could see like the different communities all spread out, and it's like in the same room. But slowly but surely, everyone started joking around with each other and then started talking with each other. And I used to host, I haven't hosted this dance in a while since the pandemic. I need to get it back going. But for about 5 years, I did a senior Valentine's dance. And it was the cutest thing ever because you're talking about seniors that are getting dressed up for this dance like it's prom again. It was super cute. And you have, you know, unfortunately, there's more older females than there are older males. And so, as the young kids say, there's a lot of thirsty senior women that are out there. And I host the dance all the time. They're like, Mike, where's our men at? And I'm like, wow, I didn't know that it's still going strong like that. But yeah, they're always asking for the men. We're like, we need some men around here. So I'm kind of dating myself back a little bit, or dating my age here. But so part of the fun, I create this little Soul Train line. And we all start dancing. We get in this line and we start dancing. And, you know, everybody kind of dances down the line and then they'll get back in line. So it's just like one person dancing, right? There's this Vietnamese lady that was actually, her birthday was on that senior dance day. She turned 94 that day. And so we all sang happy birthday to her, right? And it was super awesome. She didn't speak much. She was Vietnamese. Didn't speak much, but, you know, she even her posture was even bad. Like she was, you know, she was getting really old. So she gets in the Soul Train line, and then when it comes to her turn to dance, like there's been other Vietnamese women that went down the Soul Train line, and they kind of did the traditional dancing and stuff. So this 94-year-old gets in front of everybody, and I'm telling you, this was a mic drop moment. She turns around to the crowd, right? She faces her back to the crowd, and she literally drops her butt down and starts. If anybody knows, she starts twerking, and I'm the host here, right? So I'm like, oh my gosh, and everybody's going crazy, and I even told her everybody's cheering, and she had the most fun ever. And then I go, and at the end, I had to interview her. I was like, oh my gosh, what did you learn to do? I was like, I'm Vietnamese, you're Vietnamese, I know my culture. We don't do that kind of dancing around here. Okay, that is unacceptable. Where did you learn that? And she grabs my mic. She goes, Mike, it's my birthday, but I got to thank my Black friends right over there. And I'm telling you, I'm American born. I'm born into diversity, so I don't know about racial differences, right? To watch this happen was like a dream come true, because, you know, the whole grand opening, I promised that this would happen. We focused on their fun, we focused on their peace and their relaxation. Then we forget about those differences, right? And we're all human beings. But to see that happen, to see a cultural change right there, someone is 94 years old to step out of their culture and just say, you know what? Who cares about just Vietnamese culture? This is fun. And to see the Black community become one, it was just a dream come true. And so I say all that to say, I mean, yes, you want to look for Asian housing, but it doesn't matter. We can all be friends together. So thanks.
Thanks, Mike. Okay, so it sounds like there's a critical need for senior men.
Yes. We got to stay alive because there's some women out there that need us.
That's right. And then also it sounds like if you're looking for housing, there's just making sure that there's maybe opportunities to socialize, to get together, to be active with other residents.
Absolutely. Look for housing that provides those type of activities for you.
I'm sorry, I saw you had a question. So, and I'm not sure, because I'm not sure if the live feed was able to, I'll make sure for the question and answer period, everyone gets to have the mic. So just to repeat your question, is that sort of going back to what the beginning around just the hesitancy to have conversations around death, and whether you have some advice about how to have those conversations in your experience about how do we get people more comfortable with that topic?
Yeah, so I have to be honest, we are still struggling in this topic, but we have figured out some ways to tell them about the death. We will let them know, for example, at one of the small group therapy that's conducted by our mental health consultant, and they talk about this, and one senior speak out, and he talked to Liz, and he talked about death to other seniors, and so they can discuss together. But if we observe that if the staff ourselves, we try to talk to them, they refuse to talk about this because they still have, I believe we have to build up the trust with them, to we have to close enough to them so they may willing to speak. But for now, the main direction that we have is to talk about the deaths from other seniors. You know, yeah, we can bring some like stories, talk about the births and the whole life, the life story, and some seniors will talk about death. Yeah.
Thank you. Yeah, actually, I'm now just serving on the board of directors of a nonprofit organization in California, and then that's Chinese American Coalition for Compassionate Care. Then they majorly just devoted on that topic, the conversation. Then they really design a very effective tool. Usually they just host heart-to-heart cafe and then play some card games, and then we just openly talk about those future medical care needs. And then actually I even adopt that to my organization. And then even for our orientation or something, then we are also, because I think that's a very important topic. And anyone, no matter how young, how strong, how healthy you are right now, then I think that's some cultural transformation. Then if you're interested, we can talk more about that and then bring those very interesting tools to the seniors and even for the adults, just anyone.
Thank you, Dr. Sun. Yeah.
Thank you. Thank you for your comments. I'm very interested in suicide prevention. I do suicide prevention in Massachusetts and feel like since the seniors tend to be, have many risk factors for suicide, I wonder how the staff is trained and, people who are working with the seniors, as well as I think a lot of times, mental health issues and suicide prevention can be often best done peer-to-peer. Do you have any seniors who are going, who are talking about these issues with other seniors? Because I feel like, we don't do a good enough job of, and also we don't do a good job of de-siloing the mental health from suicide prevention, right? And so we need to do that as well. You would speak to that, that would be great.
Yeah, so as a the intention to suicide, you mentioned that we haven't met that yet because most of our seniors, when they come to our center, they most of them are like dementia, but they are still well independent. And because they come to our center, that is because they want ask for help. They want to be actively aging. So actually, I would say they're still in a very positive level because they know how important to keep their health at this time. Yeah. So yeah, sorry, I don't have the answer about that suicide, or maybe Mike or Sandy can share
Mike,
about that.
Sandy, any insights for us on that question?
Yeah, let me jump in first. So we partner with the Alzheimer's Association, and they have a dementia awareness program that is actually tailored to both staff as well as to families. So very often we will find that, we'll host, basically educational sessions, first and foremost for any staff that's hired, help them understand the signs of dementia and, the technical term is sort of a changing condition. The individuals that are enrolled in PACE already have underlying healthcare concerns, but we want the staff to be able to understand what is it medical? Is it medical or is it mental health? What are those signs? But also help educate families, get them involved in the overall health and wellness or the where they live. And we'll partner with organizations, affordable housing communities, to help provide educational sessions, even if they're not enrolled in PACE. It's more of just that community responsibility to help people understand it and look to really break down those barriers. So sometimes it's members of my organization. Very often it's members of the Alzheimer's Association that are reaching out into the community.
So Sandy, and just on the specifically in the PACE programs, particularly with Unlock, is there specific training around suicide awareness or suicide prevention or recognition of sort of, when you're speaking to someone, if there's, thoughts of suicide?
Yes, there is. It's, for us, that's very important. It could be for older adults, feeling very isolated. There isn't always that family support regarding whatever culture that you may be from. So we want to be able to make sure that people understand what are those resources and what are those signs. So to be able to direct them, we have, therapists, clinical social workers, licensed clinical social workers and such, but also that down to the drivers, the people that so often come in contact more frequently than others to look for changes in the behaviors of the individuals that are enrolled in PACE to provide some guidance and assurance that there are resources available.
Sandy.
I have several questions to everybody. So first, Sandy, please. So I graduated from Cal, and one of the PACE program was Unlock. So I'm very much familiar with it because I'm in Cal, so I was in Oakland side. So the problem is here, Houston. I realized that Houston is a huge city. So one side from Houston in the same city, but the other side, it takes a long time. San Francisco, Oakland, is not as big as Houston. So PACE program has transportation program. You pick up the patient and things like that. But Houston is big. So that's one thing that we need to put that in consideration because it is a huge city here. And also PACE program, you need to just consolidate in one PACE program. So the doctors and everybody has to be in the same network. Here, we have the world's largest medical center. So everybody belongs to different, maybe health insurance company. So that's a big problem. So I don't know whether you have any solution to this transportation issue, just like Mike mentioned. Yeah, and then also that's related to Chinese Community Center in Bamboo Village too, because of the transportation. Many seniors don't drive, and they're very much afraid to drive. And then I think it applied to anybody else to try to do something new, like Bamboo Village Residency is going to Chinese Community Center. If you're alone, you know that there is a good program that you may be qualified and you like to go. But if you're by yourself, you're kind of hesitate to do it because something new. So I think it'll be a good approach if you have a buddy system, somebody who is in the program already would try to recruit somebody that might qualify. So you go together and then you have a game or something like a champion of recruiter, something like that. That will be encouraging. That will encourage, and then the partner, the recruiter will be a partner with that. And so I teach at the University of Houston social work program, and I teach graduate students, but I teach one class for clinical social work with the elders class. So we have a graduate student, they partner with one older person who is 65 and older, and So every week, the student visits senior. They'll be a partner for one semester. So they visit 10 weeks in a row, and then they talk about something that we teach in class, some kind of aspect of aging. And they become a great partner because senior, they are asking for wisdom, and they can share their experience, and then the graduate student will learn. So they have like a younger partner with the senior. And at the end of the semester, they are great partner. So they want to even continue doing that. So that's the practical experience. Senior may want to talk about it, but they are alone. Majority of them are alone. So they have a great partnership. So I think if you have a partner or buddy system or peer buddy system that you can recruit somebody to CCC, that will be a good system, I think. And then I have that big question for you.
Well, just with what we see within the PACE world is so often it's exactly to your point, individuals that know somebody that's in the program are more likely to then join as such because it's candidly been validated by, you know, a friend, a family member and such. And just around the transportation and what's going on in Los Angeles, is, I mean, there's 9 different PACE programs within Los Angeles, in part because of the travel times. Nobody wants to get on a van for an hour, even though heavily regulated, PACE is a very heavily regulated program, but people don't want to be on a van for an hour. So we're finding more neighborhood PACE programs, smaller than you would have generally seen, but it's also easier to get to. And we're also seeing very culturally specific PACE programs, a very burgeoning amount of, you know, whether it's Hmong, whether it's Vietnamese, I mean, it is, you know, because candidly, older adults in that generation very often want to be around others that look like them, just speaking very candidly. You know, even Unlock at one of our San Francisco centers, there's 2 sides to the social element. One is specifically just, you know, monolingual. All they do is speak Mandarin. The other side is more diverse, and there's 5 different languages spoken. So it's recognizing and being flexible to realize what's going to be the most attractive way to establish the program.
Yeah, thank you very much, Sandy. Actually, our organization will be very interested in PACE program. We are just a FQHC and then having like 16 clinics around the Southeast, Houston area. And then previously we were just debating on a new guide program. Then that's also like started by CMS, and then that's to support those dementia patients in the community. I'm not sure if you're aware of the guide, and then they are going to start that for the next 8 years. And then our CEO funds just maybe not very financially sustainable if we really join that. And for the infrastructure, then that will maybe take a lot of effort. But he also mentioned to me about PACE. Then we're still, really on the edge of that, and then trying to get into those older adults care. How to do that? We're already enrolled in age-friendly health system, and then just trying to do something. Then I'm not sure to compare with PACE program and the new guide model for dementia patients. Is there any difference, or which one will be more financially sustainable?
I'd have to really look into that more. But again, with the way the PACE program is established, and there is an investment, there's no doubt. I mean, it is, you know, candidly $3 to $7 million. And that's conservatively, you know, depending upon the size of the program that you want to establish. But there's funding, and it usually takes about 18 months to go from in the red into the black with PACE. But after that, PACE programs are very sustainable. And so that's in part why organizations see the value. Not only are they serving, you know, an underserved community by the establishment of the PACE, but it does, you know, after that initial startup period, becomes very financially sustainable program.
had some questions and comments of all the panelists. Mike, waiting for you to have MC like Friday senior night at the Diamond Club. So, but
I have a low rate.
okay. But for Angela and Sandy, so question about the senior center eligibility. So my parents go to ping pong and the one of the senior dance, Shangshang dance, but they're higher incomes, so they wouldn't necessarily qualify. I know you have 55 clients, but you know, and they're probably a certain income level cutoff. What is that? And then for Sandy, you know, similar thing. You know, there's a lot of people here. You know, your study said 4,000 people that maybe need, you know, whether dual eligible Medicaid, Medicare. I've studied PACE before, where I think people bought into unlock if they're above the cutoff, right? And that's another challenge. You know, I'm a physician. There's plenty of colleagues who have come to me. It's like, oh, do you know a good geriatrician or a good geriatric psychiatrist? Or, you know, I need a lot of services and we're just doing this on our own. We're medical professionals. Yet, you know, you just mentioned the high barrier to entry. The PACE literature talks about, you know, you need a big funding source, $10 million, a foundation, some rich person or something like that. And the other barriers, you know, for profit, we know from the hospice literature that when they open a hospice to for profit, bad quality, you know, bad outcomes, right? And that's one cautionary tale with PACE. Yet also we're facing competition out there where, for example, I used to work at FQHC. You know, we have the Medicare only clinics, but now even the FQHCs are jumping in, opening Medicare only senior health clinics. And that's quite rampant here. You know, ChenMed, Iora, everybody has moved into Texas. You know, they're saying, oh, come to us for your senior care. But we know that PACE, you know, overall is better. So I just want to, again, eligibility, but also, you know, with those kind of factors, you know, uniquely local to here as well. So thanks.
So I will start first. Thank you for your comment and about the eligibility. And I also want to connect with what Dr. Christina mentioned. So for the eligibility, if the if the seniors, they are eligible for the Medicaid, it is free. All our service is free for them. So I would say that is one of the incentive for them to come outside, because they can receive free transportation, free meals, free activities, and we also will have a lot of activities for them for free. But for your parents, if they are high income, we also have a self-pay options, and we offer 450 per month for one person. But if your parents come together, they will get 10% discount. Yeah, so but because we offer a lot of like meals, free meals and activities and health education, we also will take them out to field trip every month. So we are trying to, you know, work as best as we can to provide them, because Chinese Community Center is a nonprofit organization. So we always trying to do our best as the economic allows we to do. We will offer them as much as we can. Yeah.
So PACE was established, you know, as Medicare and Medicaid. And so eligibility is essentially tailored to those that are 55 and older, live in the area where there's a PACE program. But from a financial eligibility standpoint, it's usually they have to be eligible for Medicaid. So of course that, you know, there is the option to, you know, as Angela just said, for self-pay, but under the CMS regulations, the individual has to pay the Medicaid portion if they only have Medicare and they're eligible because of their overall health. They have to pay the Medicaid portion, which it's at a state level, but, you know, conservatively, it could be $5,000 a month. only about 1% of the total people enrolled would self-pay. Very often it's done so they could then, in the terms of Medicaid, spend down and to be eligible for Medicaid. Or sometimes family members say, you know what, for that $5,000 a month, I don't have to worry about mom, dad, brothers, sisters' health care, regardless of the level of care needed, the environment, whether they need long-term care, special needs, memory care, it's all covered. So sometimes it's peace of mind, but that, 1%, it reflects that that's a very small percentage of the population. There is discussion underway to sort of change the parameters. But really for the near future, probably the next 5 to 10 years, I don't really see any changes in the regulations around that level of eligibility. Again, the point is to serve the underserved that really haven't had access to care due to being of low income.
There is a question from Wanda Choi for Angela. Are the individual interviews in the native language, and are family members invited, encouraged to be present with the senior?
Yes, so I would say one of the challenges of the seniors will be their language barriers. Most of our seniors we serve, they only speak Mandarin. So all of our staff will be bilinguals with Mandarin and English. So if the seniors they only speak Mandarin in our center, that won't be a problem for them, because and sorry for another.
Oh, yes. Point. Are family members invited and encouraged to be present with the senior?
Yes. I would say at the first, if the seniors, their family would like to come with them, we also will encourage them to do that. But I would say if they can let the seniors to be alone at our center, that will help them to interact with other seniors, not only stay close with their families. So I would say at the very beginning, it will help them to adapt with the environment change, and after they become more familiar with the environment with the other seniors, I would say it will be better for them to come along. Yes.
And there was one other question she had. Are faith-based resources allowed to be shared and explained on the topic of death? Are faith-based resources allowed to be shared on the topic of death?
I would say of course that is, because we are trying to figure out every possibilities to talk about death of this topic among our seniors. So we will also talk about their faith, about what will going on after the death, because no one know where will we going or where will be after death, especially for some of our seniors, they are Christian, so they will believe they will go to the heaven. Yeah, but for the most of the AAPI populations, they are not very have that confidence, because we also have the in the Chinese culture, we say when if you are a bad guy, you will go to hell. So we try to remove this confusion from our seniors.
I have a question. So I think for our panelists, we've talked a little bit about, sort of these taboo topics. And I think in a lot of Asian cultures, I know in my own family, if we talk about mental health, or if we talk about suicide, or if we talk about death, it's almost like inviting those into our life, and we don't want to. So we don't want to talk about them. And so, what are in your fields and your careers, what do you think are some other things that are very specific to AAPI cultures, of course, which are not a monolith, but what are some of the other kind of barriers, and what can we do personally to help overcome those and make them more socially acceptable for us to talk open and freely, which is so important in us sort of advancing these really important conversations within our own families?
Yes, so back to the language barriers, I would say that is the most biggest challenge for all the AAPI populations. Because of the language barriers, they have very limited access to health information and other resources. But I would say the good thing is for these AAPI populations, they are they have a lot of wisdom and resilience back to their life background. And another good thing is because we have a very strong community-based support for this AAPI, for example, Chinese Community Center. So they can find a lot of resources in this kind of community center. So I would say they will have more resources and connections with their health and with their life, with their, yeah.
I would, say the same. Making sure that the information that's shared is in the language and is in the, if it's written, it's all in the languages. There's no less than six. We provide documentation in no less than 6 different languages, and that's just around the Asian community, just to make sure all the dialects are properly represented. I think when information is communicated either verbally or through the written word in the languages that our participants really have grown up with, they see that we're sensitive and they're more likely to embrace the ideas to be able to understand the concepts of what's being shared.
Regarding taboo subjects, I think, I can't really give the best advice for something as local as just like within your family, but on a larger group level, I think Angela mentioned it earlier, you got to build the trust, you got to have the relationships. Sometimes like we've had funeral homes that come out and they want to talk about investing into your plot and all those things. Of course, they're looking for sales and business, but at the same time, it is something that needs to be talked about. But when they say, hey, Mike, can we come to your property and do this? And I tell them all the time, I don't think they want to talk about death, but so we got to find a way to do it. It is important to me that is talked about. So they usually start off with activities and then create the fun. Everybody laughs and giggles and has fun, and then that kind of trust happens. And then as long as one person, one senior, someone that they can relate to kind of speaks out about it, then the rest kind of speak out about it, right? Regarding death, I mean, that's hard for everybody to talk about, but I think the best way to approach that conversation is to look at it glass half full versus half empty, right? If you look at it as a countdown, it seems scary as hell, right? I mean, you're now counting down your days and how many years you have left. But if you look at it the other way, it's like, man, I lived a fulfilled life at that point, and now every extra day is just sugar on top. If you like, my dad passed away 64 suddenly. To me, I told my wife, I'm midway through 40. I'm like, man, once I hit 64, shoot, any day after that, I'm happy with, right? And so, but so if you're in your 70s, 80s, my mom's 77 now, living still very actively, just I gotta think about how to preventative care, how to get to that point, how to get to my mom's point. But yeah, I do look at it as if I can get past 64, I'm doing well for a male, so I can be available for those females. I'll still be married, but but yeah, I think looking at it that way and creating that trust and relationship and always just looking at it the positive way, I think it's a little bit easier to talk about.
Thanks, Mike. We have about 5 minutes left, so we are gonna, so if you have any questions, please raise your hand.
I just wanted to say that just like what Mike was saying, that somebody who is familiar with the community and has a trust, if that person can advocate for, let's talk about, I can't say let's talk about death, not like that, but somebody who is familiar face in the community, I think that speak a lot of voice about it to promote something to be more open to talk about.
Hi, thank you. Thanks to you guys. This has been absolutely fantastic. I have a question related to as you see your elders decline and you see family members who are either non-responsive are inappropriately responding, what kinds of things can you do and can you suggest that we do prior to you making a referral to Adult Protective Services?
That's a great question.
Yeah, so I from my experience, we have a seniors that he had dementia and he's already 98 years old and he lived in the senior apartment. And last Monday it was very freeze outside, and so we don't want our seniors to come to our center for their safety, so we closed on that day. And when our staff come to work on that day, he found the senior, the 98 years old senior, he walked on the street by himself. And so we contact to his son immediately, and they say, "Oh no, I don't know. I don't even know my father is gone, but he will be back because this happens a lot of time." But that is not a very good sign for us because we know how serious we should take for this situation. So we talked to their families, the senior's daughter and his son about this situation, and we let them know it will have you will be responsible for this if your father if something happens, if he died on the street or have a car accident on him, so you will get in trouble. So I would say the communication and educate these caregivers would be very important. So that for the health provider, we will have the responsibility to make sure that when they are on our side and we make sure their safety. So we have the front desk receptionists watch out the door every day if all the time when senior is on our side. So, but for the caregivers, we will say we will educate them to be more serious about this. Yeah.
Yeah, that is a great question, and a question I think we're still looking for the answer. We deal with it on our property where we have residents that either have no family left or the family is not showing that same amount of care that we're hoping for when we call them. Well, we can only do what we can in our own hands, and yes, at some point it would have to be Adult Protective Services to step in and help. But before we get to that point, I mean, we don't want to do that. And so, you know, I talk to my manager all the time, and I don't really train, but we talk about it, and we say, hey, maybe help create that relationship with that person because they're so isolated, and it's hard sometimes, right? And but once you create that relationship, because you are a manager, you do have the right to at least come and talk to that person, right? Whether it be just about the apartment, the living situation, but start from there. Create that friendship, create that relationship, create that trust, and see if you can kind of get them out and talking to the other seniors and get them to kind of believe in life a little bit again, you know, because I mean, it's hard because depression starts taking over and we kind of start seeing it. We've had a couple of suicides on the property. It's tough. It really is tough. And when we search for help and yeah, we don't have the family members there, then we feel it is our responsibility a little bit, you know. Even though it's not truly our responsibility, but it is. It's that we take it to heart. So, yeah, it's a great question because we're still looking for the answer. So if there are people out there in the audience that do have a better answer that can help us, please recommend any services or resources that could help us on that. But that is definitely a tough one. Oh, yes, thank you. Are you with AARP? Well, let's connect. That's why we have this conference in session, right? Thank you. Perfect.
Well, we are actually at time. So I really encourage you, if you have any more questions, comments, to make connections with Mike, Angela, and Sandy. And with that, I just really want to express my appreciation to you all for sharing so great information today, and for our folks in the audience for asking incredible questions and also making really great comments. So thank you.
Thank you, Tina. Thank you, everyone.
Thank you.